The Type 2 clinic at the Steno Diabetes Centre welcomes patients from general practice whose GP has not been able to control their diabetes successfully, often patients suffering from dysregulated Type 2 diabetes. Patients participate in a 6 to 9 month structured programme aimed at optimising their overall treatment. The clinic is run by diabetes nurses in cooperation with consultant doctors and dietitians from the Steno Diabetes Centre, and treatment is based on results from the Steno 2 study. The treatment offered by the Type 2 clinic is a 4-step programme. Step 1. Discussion of expectations and collection of data.
At
the initial meeting, it's important that we get to know the patient. Fairly quickly, we have to get an idea of who we're dealing with to prioritise our efforts. In addition, we need to collect a lot of data on the patient. Firstly, the patient will meet with the nurse for, among other things, an eye screening test. Next, we test the patient's nerve function. And then, of course, take a series of blood samples. This is what happens at the first visit, where we collect all the data we need to assess what type of treatment this particular patient requires. Step 2. Interdisciplinary treatment planning. The most important aspect of the interdisciplinary team is that we're all experts in our own fields. And patients should benefit from that, of course. Based on our discussion, we set the priorities that we consider important for each individual patient. What we consider the best treatment during this programme. Once the patient steps in the door, however, we may face a challenge in terms of what the patient wants. Because it's important to keep in mind that it's the patient who has to live with a chronic disease. It's the patient who needs to make the changes. We have to include the patient in the decision-making process. That is really important. It's also important that something happens in between visits if we're to reach our goals. We offer telephone consultations in between visits. Patients can call to discuss blood sugar monitoring or treatment adjustments. We may discuss any number of issues. But one of the major advantages is that we get to know the patient. And that means that the chances of success increase. Step 3. Participating in group-based or individual education. We have 2 options. We offer one programme for patients on an individual basis and another on a group basis. It's important that we, together with the patient, determine which the patient is most comfortable with. We encourage patients to choose the group modules, as there are definitely benefits to be had from being together with others. We have to identify the patient's needs and also what he or she is most comfortable with, because a positive attitude is important for the process to succeed. We're very careful not to just dump all our knowledge on the patients. The patients and the patients alone set the agenda. What the patients want to talk about is what's important. Step 4. Concluding meeting with a medical specialist. The patient's final visit is with the medical specialist, the nurse and the dietitian. This is when we finalise and evaluate the treatment programme. And then we decide whether the patient requires further treatment at Steno Diabetes Centre or whether he or she can be referred back to his or her GP. The results experienced by our patients are really good. You have to keep in mind that this group of patients is complex and suffers from a complicated disorder. This is called dysregulated diabetes. When it comes to blood sugar, for instance, more than 50% are in the green zone. When it comes to blood pressure, more than 60% are in the green zone. And when it comes to lipids, 75% are in the green zone. Even though this is a group of patients with a dysregulated and complex disorder. What this means is that we can refer a majority of the patients back to their own GP once their diabetes has come under control.
Jeg synes forløbet i type 2-klinikken er gået rigtig.
I feel really good about the work we do at the Type 2 clinic, when we reach the goal we've set together with the patient, and when we sense that the patient feels motivated to carry on and stick to the goals we worked on, and when the patients appreciate that they are personally responsible for their future life with diabetes. Then I feel that we've been successful. We have two key things to work with: a well-structured program with excellent teamwork and great commitment, and secondly, inclusion of the patients in their own treatment. This is crucial for success.